Welcome to our second Jane's webinar looking at the impact of the Covid-19 coronavirus on the defence sector. Those of you who listened last week will know that Jane's is following government guidance in those countries where we have offices, and we are all working remotely, so sound levels and microphone quality may not be quite up to the studio levels that we aspire to. My name is Nick Brown and I'm one of the Research and Analysis Directors here at Jane's, mostly covering naval content, but also inventory, space, strategic weapons and some other areas. Our last webinar focused mostly on budget and industrial implications of the spreading virus, reporting a mixed bag of immediate closures and industry shutdowns with long-term uncertainty and projected delays, with recessions and impacts on budgets to follow. Just 7 days on from that, some aspects have already degraded significantly, particularly for industry, but also for a range of other defence and allied organisations. These include things as diverse as Hezbollah's military wing saying that its hospitals in Lebanon are being overwhelmed by members suffering from the coronavirus, the confirmation that the major Eurosatory defence exhibition set for June has been cancelled, and NASA has suspended work on the Orion capsule and space launch system, with knock-on effects that will delay their return to the moon. It's also sadly true that entities with a malign intent are also already seeking to exploit the situation for their own means. For example, increased dependence on mobile networking and cellular communications as a result of everybody working remotely has exposed US Department of Defense networks and others around the world to increased attack. Although information around this is always sensitive, Jane's has this week confirmed that both non-secure and secure networks used by DoD and US Armed Forces officials during teleworking scenarios have seen upticks in attempted breaches.
So I'd like to start just with a cross-section of the announcements that we've seen in the week to 27 March. So beginning in Canada, CAE. We saw 465 job cuts from the Montreal manufacturing wing. We saw additional temporary layoffs. We also saw salary increases suspended and cuts as well, particularly for top executives. Over at Boeing, we saw the dividends suspended and the share repurchase suspension continues. And again, as at CAE, the chief executive and the chair, they in this case decided to forgo pay for the rest of the year. Similar picture at Triumph. And in Europe, Airbus has secured a euro 15 billion credit line. The dividend has been cancelled, as well as a hiring freeze and non-essential expenditure has been cut. Interestingly, at BAE Systems, we learned during this week that staff on site at the Barrow nuclear submarine yard have fallen from 9,500 to just 750. These aren't job cuts. This is simply non-essential staff being sent home to reduce the risk of spreading the virus. Across on the other side of the world, very different picture. So Hanwha of South Korea, we asked them about the impact and they reported limited disruption, both financially and technically. Meanwhile, at Mitsubishi, the F-35 final assembly checkout facility, that resumed operations during the week ending 20 March after a 2-week pause. Next slide, please.
This is a map of published by the WHO Situation Report on 26th March, which now states that the confirmed number of cases across the world has reached over 500,000 with over 20,000 deaths. Since our last webinar, the US now has the highest number of cases, more than China and Italy. Therefore, the impact of all of this on national security is also going to be very large. This map is produced with data from our new Jane's COVID-19 National Security Bulletin. This is a global look at data from 20th to 26th March. Let's now take a look at each region individually to understand the measures taken by the military to combat COVID-19. Next slide, please. Since last week, the number of events for the Americas has significantly increased as the number of confirmed cases increase. As for COVID-19 cases in the military, the US is one of the few countries that actually provides regular updated figures. As of 26 March, the DoD announced 280 US military personnel and 62 contractors have been tested positive for COVID-19. Just yesterday, The largest spike in numbers was reported from the US Navy with 35 new confirmed cases in one day. Although the US European Command reported 35 positive cases of COVID-19 among its 72,000 service members, the commander issued a statement assuring that readiness levels remain unchanged. In South America, armed forces are deployed for mainly law enforcement and support activities. The military in Brazil, Venezuela, Peru, Colombia are deployed to enforce border closures, reduce civilian movement during the lockdown, and deal with theft of essential resources and fuel. The entire situation has also forced countries to cut short or cancel several training exercises. One of them to be cut short last week was a bilateral army exercise, VITA, between the US and Colombia. The US Navy also postponed its large-scale exercise 2020 until next year. One very interesting geopolitical development is Russia's medical assistance to Italy. While China uses its private sector and private entrepreneurs to provide medical assistance, Vladimir Putin has decided to take the military route to coronavirus diplomacy. After a brief phone call with the Italian Prime Minister, Russia decided to send its military medical professionals and military aircraft to Italy. As of 26 March, Russia sent 14 Il-76 planes with 8 mobile brigades of medics, 100 military virologists and epidemiologists, equipment for disinfecting transport vehicles, etc. were all delivered to Italy, all with a picture that said, "From Russia with love." And according to the Russian MOD, a Russian-Italian anti-coronavirus situation headquarters will operate from Orio al Serio aerodrome in Bergamo, Italy. While Russia has maintained good ties with Italy even after economic sanctions by the EU since 2014, and despite European criticism of Russia's organized disinformation campaign during this coronavirus epidemic, it is undeniable that Russia is using this pandemic as an opportunity to strengthen its relationship with Italy. This could, in turn, lead to Italian support for Russia during European discussions of a probability of extending economic sanctions in July after the current period, which was extended in December 2019, ends. And with that, I pass on to my colleague Rizwan for developments in Asia Pacific.
So meanwhile, another country that has rethink this particular concept is China itself. So now China, or the PLA Navy, has one hospital ship and is known as the Daishan Dao or Peace Ark. But in the wake of the COVID-19 outbreak, they realized that this hospital ship is not capable of handling COVID-19 patients. And because of this, the CSSC Institute 701, which is a state-owned ship designer and builder, they have been tasked and they have recently completed a concept design for a floating hospital that has been designed or optimized for pathogen outbreaks.
The information you'll hear now is a snapshot of a greater survey which is published online in Jane's Defence Weekly. First, we will start with military hospitals and the assistance provided to civilian health services. In many European nations, the size of the military medical service tends to be small, with a large portion of the services being made up of medical professional reservists or similar. Therefore, the direct impact on helping patient care can be quite negligible, although there are some cases where militaries have stepped in to help. In France, the French Armed Forces Health Service has activated 5 of its 8 training hospitals. Each hospital has around 100 beds, 40 of which are intensive care units. Last week, it was mentioned and early on in the webinar that USNS Mercy and Comfort are in the process of being deployed. Mercy is being deployed to Los Angeles on the West Coast and expected to arrive today, Friday, the 25th of March. Comfort is being sent to New York. Both ships will work with FEMA and other interagency partners. Additionally, the Army Corps of Engineers is on the ground in New York, already beginning critical work to retrofit existing buildings to provide additional medical infrastructure. In the Croatian capital Zagreb, the army has erected a self-sustaining camp attached to the Dubrava Clinical Hospital. This has increased the bed capacity by 220 beds. Zagreb is also having to deal with the aftermath of an earthquake on Sunday, the 22nd of March. The Polish army has prepared a mobile biological laboratory which is capable of carrying out 120 coronavirus tests per day. The tests are also being carried out by the Centre for Diagnostic and Combating Biological Hazards in Puławy of the Military Institute of Hygiene and Epidemiology. In the UK, military engineers and planners are currently supporting the National Health Service to develop the NHS Nightingale Hospital based at the Excel Centre in London. In addition, 150 military personnel are being trained to deliver oxygen tankers in support of the NHS. This is part of a larger 20,000 strong pool of armed forces personnel placed on standby to help with larger operations.